Hello guys, I'm Dr. Mahesh Tanakarasu. I welcome you all to this new session. So in this session, we're going to talk about something very important that everybody feels or everybody goes through at some point in time, right? I've been feeling a little anxious or nervous since this morning. Ever since I started preparing for this topic, I kind of feel so. Okay, we're going to talk about anxiety disorder and panic attack in this video. Okay, so make sure you watch this video without skipping it to get all the answers to your questions. Yes, we're going to talk about what do you mean by this anxiety disorder and panic attack, and what are the different types of anxiety disorder, and what are the causes and the risk factors, and what are the symptoms of anxiety disorder, and how do you diagnose this anxiety disorder. Once it's diagnosed, how do you treat this anxiety disorder? Okay, after treatment, what are things that you need to focus? What are the foods that I have to eat? Okay, this is what we're going to talk about in this video. So please make sure you watch this video without skipping it, okay? And in addition to that, if you have not subscribed to my channel yet, please go ahead and hit the subscription button down below and do like it or leave a comment in the comment section, okay? Let's get in there, guys. Anxiety disorder, okay? What is the definition of anxiety disorder? Anxiety is a normal and common, emotion. It's just your brain's way of reacting to stress. Everybody at some point in time feels anxious, now and then. That's okay to feel anxious, but constantly feeling anxious is something abnormal. That's kind of disorder, right? Occasional anxiety is okay. When I'm going to take an exam, or when I'm going to sit for an exam for 3 hours, and if I did not prepare for that exam, I may feel anxious. When I'm working in my job, when I'm going to meet my boss, if I did not do the job on time, I may feel anxious, right? If I go meet my wife who is very angry, I may be anxious, right? So this is some sort of a common emotion or normal feel that everybody feels, okay? Now, what are the types of anxiety disorder? See, there are several types of anxiety disorder and panic attack. So we are going to just focus on a few things. General anxiety disorder, social phobia. General anxiety disorder, many women and men get it, like men less predominantly compared to women. And when it comes to this social phobia, some people are, they feel very anxious. They have this overwhelming or undue fear. They always worry about something. It's just out of proportion. They just react, excessively disproportionate to the situation or disproportionate to the event. They don't go to any function, they don't go to any social gathering, they don't meet with their friends, they don't go talk to their friends, they don't talk to their boss, because they always keep worrying that, okay, that guy will judge me, or, I will get embarrassed, or, they will make fun of me. For simple reasons, for simple things, they always feel anxious. And for this, they always avoid simple meeting or social gathering, or being in public, or just casually talking to some people. It's called kind of social phobia. And there are many more phobias like acrophobia, like fear of heights, or fear of dark places like agoraphobia. And some people have a separation anxiety disorder. For example, you would have seen when you send a kid to school, away from mom, the kid cries, right? That's a separation. But the kid is just a small baby. She would not understand. And the same thing is also common with adults. They get over with it. There's a separation anxiety disorder. Okay. And after these types, what are the causes and risk factors for this anxiety disorder, panic attack? Genetics and certain things are non-modifiable. Environmental factors, you can't change all that. But what you can change, for example, a person is addicted to, or tobacco or alcohol, or some recreational backstreet drugs. These are modifiable things. They can change all that. One can quit smoking, one can stop drinking alcohol, or one can start drinking alcohol, less compared to what he was doing before. So certain things, this can be modifiable. Okay, after this, what are the symptoms? How people present with anxiety disorder or panic attack? They always come to emergency room with symptoms like acute shortness of breath. They come into emergency room, doc, I'm not able to breathe. Something is there in my chest, so giving me a blocked sensation. I can't breathe, my heart is beating too fast. I'm sweating. I have pain. I feel dizzy. I'm going to pass out. Something like that, and they give you a similar picture to a heart attack. And as a doctor, what do you do? Irrespective of young age, whatever, doesn't matter whether the patient is young age or like a middle age, like 40s, 50s, you will have to do ECG and chest x-ray and blood test. Okay, right? You will always bring this. So in addition to the symptoms, how do you diagnose all this? Obviously, you have to take ECG to make sure the heart is okay. You want to rule out a heart attack or some other heart causes that can cause shortness of breath. And then you will want to check the patient's saturation of oxygen in the blood, right? When you check the saturation of oxygen, it may show like a 99% or a 100% on room air. But on the other hand, if a person has acute shortness of breath and from underlying heart causes, the person will be having positive changes in the ECG. Or if the patient has underlying lung problems, he will be having a less saturated oxygen in the blood. But on the other hand, here, anxiety disorder or panic attack, they will be having a normal saturated oxygen in the blood. SpO2 or SaO2 is like 98, 99, 100%, that's normal. But you cannot just undermine that, okay, this person is having panic attack. He may really have a underlying heart problem or lung problem. You have to evaluate that clearly, like just doing a D-dimer test or doing ECG or taking a chest x-ray. If necessary, you have to even go for a CT chest to make sure everything is okay. All right. Now, what are the diagnostic tests? There is no single diagnostic test to diagnose, okay, this person has an anxiety disorder or this person has a panic attack. There is no single diagnostic test. It's all the way your doctor talks to you and how he understands you and what are the symptoms that you have, and then doctor correlates with the clinical investigation test, and then they diagnose, okay, this person has a panic attack or this person has an anxiety disorder or this person has a real heart attack or this person has a real lung problems, things like that. Okay, after it gets diagnosed with anxiety disorder, there are lots of treatments available, starting from antidepressants like SSRIs, SNRIs, benzodiazepines, buspirone, and many other drugs, tricyclic antidepressants, monoamine oxidase inhibitors. There are several drugs out there on the market that your psychiatrist or psychologist or clinical neurophysiologist would do. Even a general physician can do that, but psychiatrists are the experts on this. Okay, so when you start taking the medication that your psychiatrist prescribes to you, you should take these medications for at least like minimum 4 to 6 weeks to see its beneficial effect. You cannot just pop up 1 or 2 tablets for 1 or 2 days and the doctor, I don't have any positive outcome, I still have this panic attack or anxiety disorder, this medicine is useless. You can't say so. At least you have to take that medicine for at least 6 weeks to see some minimal beneficial effect. You know what I'm saying, right? Okay, that is. Now you are on treatment. What are the tips or what are the foods that you can have to stay away from anxiety disorder, or once you're diagnosed with anxiety disorder, how you can reduce in the future, how you can reduce the further episodes in the future? So go for foods like nuts and seeds like Brazil nuts, pumpkin seeds, chia seeds, and all that. Go for fatty fish like salmon, herring fish, sardine fish, mackerel, tuna fish. They are loaded with vitamin D and briny fatty acids like DHA and EPA fatty acids and all that. Okay, and go for chamomile tea, green tea, yogurt. They are all good. Or anxiety disorder or panic attack because of imbalance in the chemicals, right? So when you take these medications, your chemicals in your brain try to get balanced so that the panic attack or anxiety disorder will get subsided eventually. Stick to your treatment plan. That's the most important thing. And then if you have any things like substance abuse, of course you will have to get rid of them, like alcohol, or say no to alcohol, so no to smoking or recreational drugs. Okay, get enough sleep. Go for a physical activity like 20 to 30 minutes of exercise every day, just 150 minutes every week. That's the most important thing. Get good sleep, like 6 to 8 hours of sleep, and try to avoid deep fried food items. In that way you will reduce cholesterol and other possible medical comorbidities. Hope you guys enjoy this video. I'll see you all in our next video. Until then, it's bye bye, Dr. Mahesh signing off.